often the first and most obvious sign of breast cancer. The lump may feel hard, painless, and have irregular edges, or it may be. Hello and welcome to Health, Fitness and Nutrition, the YouTube channel where we share useful tips and information on how to live a healthy and happy life. In today's video, we are going to talk about a very important topic, the early warning signs of breast cancer. Breast cancer is a type of cancer that develops in the breast cells and progresses in stages. It is one of the most common cancers among women, but it can also affect men. According to the American Cancer Society, about 1 in 8 women in the US will develop invasive breast cancer during their lifetime, and about 1 in 883 men will develop it as well. Breast cancer can be treated successfully if detected early, but sometimes it does not cause any symptoms until it is advanced. That is why it is very important to be aware of the changes in your breasts and to get regular screenings and checkups. So what are some of the early warning signs of breast cancer that you should look out for? Here are some of them. A new lump or mass in your breast or underarm. This is often the first and most obvious sign of breast cancer. The lump may feel hard, painless, and have irregular edges, or it may be soft, tender, and round. Sometimes, the lump may not be felt but seen on a mammogram. If you notice any new or unusual lump in your breast or underarm, you should see your doctor as soon as possible. Changes in the size, shape, or appearance of your breast. This may include swelling, shrinking, flattening, or dimpling of your breast. You may also notice that one breast looks different from the other. These changes may be caused by hormonal fluctuations, pregnancy, breastfeeding, or aging, but they may also indicate breast cancer. Changes in the skin of your breast or nipple. This may include redness, irritation, scaling, flaking, thickening, or puckering of the skin. You may also notice a rash or an orange peel texture on your breast or nipple. These changes may be signs of inflammation or infection, but they may also indicate a rare but aggressive type of breast cancer called inflammatory breast cancer. Nipple discharge or inversion. This means that fluid comes out of your nipple when you are not breastfeeding or pregnant. The fluid may be clear, bloody, yellow, green, or brown. It may come out spontaneously or only when you squeeze your nipple. Nipple discharge may be caused by benign conditions such as cysts, infections, or hormonal imbalances, but it may also indicate breast cancer. Nipple inversion means that your nipple turns inward instead of sticking out. This may be normal for some people who have always had inverted nipples, but if it happens suddenly or only on one side, it may be a sign of breast cancer. Pain in your breast or nipple. This means that you feel discomfort, tenderness, or soreness in your breast or nipple that does not go away. Pain in your breast or nipple may be caused by many factors such as menstrual cycles, pregnancy, breastfeeding, injury, infection, or mastitis, inflammation of the breast tissue, but it may also indicate breast cancer. These are some of the common early warning signs of breast cancer that you should be aware of and report to your doctor if you notice them. However, keep in mind that these signs do not necessarily mean that you have breast cancer. Many benign conditions can cause similar symptoms and most breast lumps are not cancerous. The only way to confirm a diagnosis of breast cancer is by doing a biopsy, removing a sample of tissue from the suspicious area and examining it under a microscope. Your doctor may also order other tests such as blood tests, ultrasound, using sound waves to create images of your breast, MRI, using magnetic fields to create images of your breast, or PET scan, using radioactive substances to show how your cells are functioning. The treatment for breast cancer depends on many factors such as the type and stage of the cancer, how far it has spread, the size and location of the tumor, mass, the characteristics of the cancer cells, such as hormone receptors and genetic mutations, your age and overall health, including whether you have reached menopause, and your personal preferences. The main types of treatment for breast cancer are surgery. Surgery is often the initial treatment for breast cancer and involves removing the tumor and surrounding tissue. The two primary surgical options are lumpectomy, also known as breast conserving surgery. This procedure involves removing the tumor and a small margin of healthy tissue around it while preserving the rest of the breast. Mastectomy. In this procedure, the entire breast is surgically removed. Depending on the extent of cancer, a simple mastectomy or a modified radical mastectomy, removal of breast tissue, nearby lymph nodes, and sometimes the lining over the chest muscles, may be performed. Radiation therapy. Radiation therapy uses high-energy rays, such as X-rays or protons, to kill cancer cells and shrink tumors. It is often used after surgery to destroy any remaining cancer cells in the breast, chest wall, or nearby lymph nodes. Radiation therapy can be external, where a machine directs the radiation towards the affected area, or internal, where radioactive substances are placed inside the body near the cancer site. Chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells or prevent them from dividing. It is typically administered intravenously or orally, allowing the drugs to circulate throughout the body and target cancer cells wherever they may be. Chemotherapy may be used before surgery to shrink tumors, neoadjuvant therapy, or after surgery to eliminate any remaining cancer cells, adjuvant therapy. Hormone therapy. Hormone therapy is used when the breast cancer cells have receptors for estrogen or progesterone, which fuel their growth. This treatment involves the use of drugs that block the effects of these hormones or reduce their production in the body. Hormone therapy can be administered orally or through injections and is often prescribed for several years. Targeted therapy. Targeted therapy focuses on specific features of cancer cells that make them different from normal cells. These therapies use drugs that specifically target these unique characteristics, such as certain proteins or genetic mutations, to disrupt the growth and survival of cancer cells. Targeted therapies can be used alongside other treatments, such as chemotherapy or hormone therapy. Immunotherapy. Immunotherapy aims to stimulate the body's immune system to recognize and destroy cancer cells. It uses drugs that either enhance the immune response against cancer cells or block the mechanisms that prevent immune cells from recognizing cancer as a threat. Immunotherapy has shown promising results in some cases of breast cancer, particularly in certain subtypes. Some people may need only one type of treatment while others may need a combination of treatments. Your doctor will discuss with you the best treatment plan for your specific case. Breast cancer can be a scary and overwhelming diagnosis to face, but there is hope and help available. Many people survive and thrive after being treated for breast cancer thanks to advances in research and technology. You are not alone in this journey. There are many resources and support groups that can provide you with information, guidance, emotional support, practical assistance, and inspiration. We hope this video has been helpful and informative for you. If you have any questions or comments about this topic or any other health-related topic that you would like us to cover in our future videos, please leave them below. And don't forget to subscribe to our channel Health Fitness Nutrition for more videos like this one. Thank you for watching and stay healthy. Hello and welcome to Health, Fitness and Nutrition, the channel where we share the latest and greatest tips on how to live a healthy and happy life. In today's video, we're going to talk about a very controversial topic, vegetable oils. Are they good or bad for your health? What are they made of? And how do they affect your body? Let's find out. Vegetable oils are edible oils extracted from plants, such as soybean, corn, sunflower, olive, and coconut. They are widely used in cooking and baking, as well as in processed foods like salad dressings, margarine, mayonnaise, and cookies. You may think that vegetable oils are healthy because they come from plants, but that's not necessarily true. In fact, some vegetable oils may cause more harm than good to your health. One of the main problems with vegetable oils is that they contain a lot of omega-6 fatty acids. Omega-6 fatty acids are essential for your health, but only in moderation. They help regulate inflammation, blood pressure, blood clotting, and immune response. However, when you consume too much omega-6 fatty acids, they can cause chronic inflammation, which is linked to many diseases such as heart disease, diabetes, obesity, and cancer. The ideal ratio of omega-6 to omega-3 fatty acids in your diet is 4:1 or lower. However, most people consume way more omega-6 than omega-3 fatty acids, sometimes as high as 20:1 or even 50:1. This is mainly due to the high consumption of vegetable oils that are rich in omega-6 fatty acids, such as soybean oil, corn oil, sunflower oil, and cottonseed oil. These oils are often labeled as heart healthy and recommended as an alternative to saturated fats like butter and lard. But the truth is that they can increase your risk of heart disease by raising your LDL, thus bad cholesterol, and lowering your HDL, thus good cholesterol levels. Another problem with vegetable oils is that they are highly processed and refined. To extract the oil from the plants, they are often treated with chemical solvents or high heat. This can damage the oil and make it rancid and oxidized. Oxidized oils can produce harmful compounds called free radicals that can damage your cells and DNA and cause oxidative stress. Oxidative stress can lead to aging, inflammation, and various diseases. Some vegetable oils also undergo a process called hydrogenation or partial hydrogenation. This is done to make them more solid and stable at room temperature and increase their shelf life. However, this also creates artificial trans fats that are very bad for your health. Trans fats can raise your LDL cholesterol and lower your HDL cholesterol levels even more than saturated fats. They can also increase your risk of heart disease, stroke, diabetes, and Alzheimer's disease. So what are some healthier alternatives to vegetable oils? Well, you can choose oils that are low in omega-6 fatty acids and high in monounsaturated or polyunsaturated fats. These include olive oil, coconut oil, avocado oil, and flaxseed oil. These oils are generally considered healthier options because they have a more balanced ratio of omega-6 to omega-3 fatty acids. For example, olive oil is rich in monounsaturated fats, which have been associated with a reduced risk of heart disease. It also contains antioxidants that help protect against oxidative damage. Coconut oil is another popular alternative to vegetable oils. It is high in saturated fats, but unlike other saturated fats, coconut oil contains medium-chain triglycerides, MCTs. MCTs are easily digested and can be used as a quick source of energy. Some studies suggest that MCTs may help with weight loss and improve cognitive function. Avocado oil is another excellent choice. It is rich in monounsaturated fats and also contains vitamin E, which is an antioxidant that helps protect cells from damage. Avocado oil has a high smoke point, making it suitable for cooking at higher temperatures. Flaxseed oil is a plant-based oil that is high in omega-3 fatty acids, specifically alpha-linolenic acid, ALA. Omega-3 fatty acids are known for their anti-inflammatory properties and their benefits for heart health. However, it's important to note that flaxseed oil should not be used for cooking as it has a low smoke point and can become rancid easily. It is best to use flaxseed oil as a dressing or add it to smoothies and other cold dishes. It's also worth mentioning that butter and ghee, clarified butter, can be used in moderation as alternatives to vegetable oils. While they are high in saturated fats, recent research suggests that saturated fats may not be as harmful as previously believed. However, it's still important to consume them in moderation and choose quality sources. When it comes to using oils for cooking, it's essential to consider the smoke point. The smoke point is the temperature at which the oil begins to break down and release smoke. When an oil reaches its smoke point, it can develop a bitter taste and release harmful compounds. Oils with higher smoke points, such as avocado oil and coconut oil, are better suited for high-heat cooking methods like frying and baking, while oils with lower smoke points, like olive oil and flaxseed oil, are better for low-heat cooking or as dressings. In conclusion, while vegetable oils are commonly used in cooking and processed foods, they may not be the healthiest choice due to their high omega-6 fatty acid content, processing methods, and the formation of harmful compounds like trans fats. Opting for healthier alternatives such as olive oil, coconut oil, avocado oil, and flaxseed oil can provide you with a better balance of fats and potential health benefits. Remember to use oils in moderation and consider their smoke points when cooking to maintain their nutritional value and avoid the formation of harmful substances. Thank you for watching, and don't forget to subscribe to our channel for more valuable insights on health, fitness, and nutrition. Hello and welcome to Health, Fitness and Nutrition, the YouTube channel where we explore the amazing wonders of our bodies and how to keep them healthy and strong. In today's video, we're going to dive deep into one of the most complex and fascinating organs in our body, the human brain. The brain is the control center of our nervous system, responsible for processing sensory information, regulating vital functions, and enabling cognition, emotion, memory, and learning. But what is the brain made of? How does it work? And what can we do to protect it from damage and disease? The brain is composed of two main types of cells, neurons and glia. Neurons are the basic units of communication in the brain, transmitting electrical and chemical signals to each other and to other parts of the body. Glia are supporting cells that provide insulation, protection, nutrition, and repair for neurons. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. The cerebrum is the largest part of the brain, divided into two hemispheres that are connected by a bundle of fibers called the corpus callosum. The cerebrum is responsible for higher cognitive functions such as language, reasoning, problem-solving, creativity, and personality. The cerebrum is also divided into four lobes: the frontal lobe, which controls planning, decision-making, and motor skills; the parietal lobe, which processes sensory information such as touch, pain, temperature, and spatial awareness; the temporal lobe, which handles auditory information such as sound, speech, and music; and the occipital lobe, which deals with visual information such as color, shape, and motion. The cerebellum is located at the back of the brain, below the cerebrum. It is involved in coordinating movement, balance, posture, and fine motor skills. It also plays a role in learning and memory. The brainstem is located at the base of the brain, connecting it to the spinal cord. It controls vital functions such as breathing, heart rate, blood pressure, digestion, and sleep. It also relays information between the brain and the rest of the body. The brain, being a vital organ, is well protected by a series of layers and mechanisms that safeguard its delicate structure and ensure its proper functioning. One of the primary protective layers is the meninges, which are a set of three membranes that envelop the brain and spinal cord. The outermost layer of the meninges is called the dura mater, followed by the arachnoid mater, and the innermost layer known as the pia mater. The meninges serve as a physical barrier, shielding the brain from external shocks, impact, and other mechanical forces that could potentially damage its structure. They also provide a supportive framework for blood vessels, nerves, and the cerebrospinal fluid, CSF, system. Cerebrospinal fluid, CSF, is a clear, colorless fluid that surrounds and bathes the brain and spinal cord. It is produced by specialized cells in the ventricles of the brain. CSF performs multiple crucial functions. Firstly, it acts as a cushioning agent, protecting the brain from sudden movements or impacts by absorbing and distributing the forces. This helps to reduce the risk of injury and trauma to the brain tissue. Additionally, CSF serves as a medium for exchanging nutrients and removing waste products between the brain and the blood vessels. It carries essential substances, such as glucose, oxygen, and various ions, from the bloodstream to the brain cells, providing them with the necessary nourishment. Simultaneously, CSF helps eliminate metabolic waste products and other potentially harmful substances from the brain, maintaining a stable internal environment. Another vital protective mechanism for the brain is the blood-brain barrier, BBB. The BBB is a highly selective filter formed by specialized cells lining the blood vessels in the brain. Its primary function is to regulate the passage of substances between the bloodstream and the brain tissue. The blood-brain barrier allows essential nutrients, oxygen, and specific molecules necessary for brain function to enter the brain while preventing the entry of harmful substances, toxins, and pathogens. The selective permeability of the BBB is achieved through the presence of tight junctions between the cells lining the blood vessels. These tight junctions create a barrier that restricts the movement of most substances, including large molecules and potentially harmful compounds, from entering the brain tissue. The blood-brain barrier plays a vital role in maintaining the homeostasis of the brain by protecting it from infections, toxins, and fluctuations in the composition of the blood. The brain is an amazing organ that allows us to think, feel, learn, and interact with our environment. It is also vulnerable to various disorders and injuries that can impair its function and quality of life. Some of these include strokes, tumors, infections, trauma, degenerative diseases such as Alzheimer's and Parkinson's, and mental illnesses such as depression and anxiety. To keep our brains healthy and functioning well, we need to take care of our physical and mental health. Some of the things we can do are: eat a balanced diet. Consuming a diet that is rich in antioxidants, omega-3 fatty acids, vitamins, minerals, and water can provide the necessary nutrients for brain health. Antioxidants help protect the brain from damage caused by free radicals, while omega-3 fatty acids support brain function and development. Exercise regularly. Regular physical exercise has been shown to improve blood flow and oxygen delivery to the brain. This promotes the growth of new neurons